Hello everyone, today's video is about high-dose vitamin B12 therapy. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you wouldn't mind taking a quick moment at some point to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So I saw a patient earlier today and she's been using high-dose vitamin B12 therapy and doing really well with it. So that was motivation to say, I don't think that I've ever posted a video on this before, so why not do it today? So with this patient, she's had a long-standing history of a lot of nerve deficiency symptoms, balance problems, weird like numbness and tingling randomly happening in different parts of her body, like lips, upper extremities, just like weird like nerve jerks or like muscle jerks, I should say, weird like loss of sensation or altered sensation in different areas of the body. Labs, imaging, everything looked totally fine. Doctors haven't been able to figure out what, her medical doctors haven't been able to figure out what to do. And like, that's just the way you are. It's just a quirky thing, and good luck. The patient also had a history of a lot of digestive issues, so we've been working on those. She was referred to me by a colleague, and we've been working on those, and seeing some good improvement over time. But like the nerve stuff just wasn't coming around. So the one day I said, well, why don't we try some high-dose B12 therapy? Started that, and lo and behold, it has not been a fast process. We've been working with this for probably the better part of, I don't know, I would say a year and a half now, maybe a year anyways, maybe a year and a half. But there has been this gradual improvement where just things are getting better and better, like balance issues, thing of the past. Sensation in the lower extremities, basically back to normal. Upper extremity, loss of sensation, tingling and stuff like that, thing of the past. Still a little bit of facial stuff from time to time. Certain things will get triggered if there's too much pressure on an area, because one of the things that nerves that are already cranky really generally don't like is even more pressure on them. And so like, if you imagine, like say you were, lying on your arm the wrong way while sleeping or sitting somewhere, your limb, falls asleep, so to speak. If somebody comes along and starts poking at that limb, it's gonna be it really hurts. It's really bothering me more because the nerve's already cranky from having too much pressure on it. Now that extra sort of pressing pressure is making it even worse. Just give you a little context for what I'm talking about there. So anyways, we've seen this kind of gradual improvement, and it's been really encouraging. So I guess the couple of things that I wanted to mention here is that I've used this protocol with other patients before. It's a protocol that I actually adapted from working with patients on the autism spectrum once upon a time. I did extensive training many years ago now, probably about 14 years ago now, in something called the Biomedical approach to autism. And and really to just differentiate here, folks that are on the autism spectrum, are neurodivergent, and that in and of itself is not pathological. It's just a neurological difference. However, some individuals on the autism spectrum have certain challenges that lead to day-to-day problems. If say they have an inability to speak, or inability to communicate effectively, or they might have learning challenges, or there might be like in children, like certain behavioral challenges or whatnot, or there could be kind of concomitant issues with kids having seizure activity, or they're neurodivergent in an ADHD kind of way as well, and that's causing learning challenges or whatnot. So it's I think it's important just to note that historically the autism spectrum was kind of pathologized, which in hindsight was not a correct approach to take. Medicine has made many mistakes over the course of time. That was one of them. But talking about using certain treatments to help with certain symptoms or challenges that can be characteristic of some individuals on the autism spectrum. So just to differentiate that. So in the biomedical approach to autism community, one of the treatments that's used, not all the time, but in many cases, or it has been used many times over the course of time, is this really high dose subcutaneous injectable vitamin B12 treatment. And so I use this with pediatric patients over time, some adult patients on the autism spectrum where it was indicated, and sometimes it was very helpful and effective. And so I thought to myself, many moons ago now, probably 10-ish years ago, well, why wouldn't this potentially help some adult patients as well, or individuals who are not on the autism spectrum? They might need mega doses of B12 as well. And so I started using this with some patients who are having chronic nerve issues or chronic fatigue issues, chronic brain fog issues, various issues. And while it's not a silver bullet for everyone, it has been very, very helpful, very effective for many patients over time. I would say that ballpark for patients where it seems to be indicated, and by that I mean patients where we've tried lots of other things that make sense and we're just maybe not getting fast enough progress, or maybe the patient has hit a plateau, and then we have some evidence to suggest that maybe they were malabsorbing, or maybe they said, like, when I started on that B complex, it helped. It didn't knock it out of the park, but it helped. I got that Myers cocktail, that IV nutrient infusion that had some different B vitamins in it, and it helped, but just temporarily. There are certain clues in patients where it seems within reason that they would respond to some high-dose B12, I would say within that patient population of the high-dose B12 protocol, these B12 shots that I'm referring to, I'd say it has like ballpark around maybe a 75% success rate, give or take. I haven't really thought about those numbers in terms of the broader spectrum, but I would say that, if I had to throw out a number, it's, so if I had just a random patient walk into my office, they have complex chronic illness challenges, I'd say maybe there's like a 10% chance that the B12 protocol is going to help them. But within a certain niche population, that would go up to 75% if there were predisposing factors or clinical clues that made it seem like maybe they would be more likely to respond to the B12. So another way of putting it is that I don't just recommend this across the board to patients, but in well-selected patients, I do recommend it. It has a pretty high success rate. So as always, I can't give any direct advice over social media, direct protocols or anything like that, but just to give a little more insight in what this looks like, patients basically start with like a fairly standard amount of injectable subcutaneous B12. The B12 we use is very high concentration. Most B12 is 1,000 micrograms, which is 1 milligram per milliliter. So you drop, a full milliliter, inject that, and that's, 1 milligram of B12. The stuff that we use is actually 10 times stronger. So it's 10 milligrams per milliliter. So that allows us to get away with using a lower volume, but still getting a, good amount of B12. So we're able to use generally use insulin syringes to drop B12 in units as opposed to full milliliters, and then we can still get a good volume. So for example, if we had 10 milligram per milliliter vitamin B12 solution, we'd only need to inject 0.1 milliliters, which would be 10 units on an insulin syringe to get that 1 milligram of B12, so 1/10 of the volume. So that allows us to inject it subcutaneously, and then it also gives us the wiggle room to use higher dosages, because oftentimes we'll go up to like 4, 5, 6 milligrams per dosage, and without needing to inject like a teaspoon's worth of B12 into someone. By injecting it subcutaneously, my understanding of that, and I'm to be honest not sure if this is actually something that's been studied or if it's something that's just been hypothesized, although clinically it seems to play out as being the case, that when we inject subcutaneously, it leads to more of like a slower release into the tissues, as opposed to just injecting into a muscle belly or injecting intravenously, where you get kind of the B12 all at once. So by injecting these high doses of B12 subcutaneously, then, as I said, in about 75% of well-selected cases, it can be really impactful. And the biggest changes that I've seen are with chronic nerve symptoms, fatigue, and brain fog. Those are the symptoms that usually will respond the most reliably. There may be other symptoms that have improved over time, but I can't think of any off the top of my head. What else do I want to say about that? Oh, right. So generally speaking, if I'm thinking like maybe we want to try some high dose B12 with a patient, we'll usually start with a higher dose oral option first, unless the patient really prefers not to and jump right to the injections. But I have found that in many cases, the high dose oral B12 just does not knock it out of the park, but the injectable form does. And I assume that has something to do with the fact that we can only absorb so much B12 through our intestinal tracts at one given time. So I think sometimes the injections seem to be needed for some cases. So I'll leave it there for now. The video is kind of dragging on a bit with time, so I'll leave it there for now. If there's any follow-up questions on this, any interest in this, I'll happily post another video. If anybody has tried high-dose B12 and want to comment on how well that worked for you, be happy to hear about that in the comment section. And yeah, I hope that this was of interest.